Good afternoon, doctors. This is Dr. Anushri from BGN RadarOpus team. I welcome you all in this live webinar session. So today I will present this session on understanding how to manage high cholesterol levels with RadarOpus software. So in this session, we will understand about cholesterol and we will see a case presentation on cholesterol that have been managed with the help of RadarOpus software. So let's begin with the session. So this is a picture defining how cholesterol can be deposited in your arteries and how it can form the fatty plaques, which will further cause atherosclerosis. So this is just a picture depicting hypercholesterolemia. Now, introduction about cholesterol. So it is an waxy, fat-like substance in the blood. It is important to keep the cells in our body healthy. And it comes from two different sources in our blood. First is from the blood source, which comes from liver, and it helps the body to build cells to make hormones and vitamins. So one is directly coming from the liver, and other cholesterol which we gain is from the diet, which we take in the form of animal products like meat, eggs, and milk. So first is the blood cholesterol and another is the dietary cholesterol. So these two are the different sources of cholesterol. Now, too much bad cholesterol in the blood can increase the chance of getting heart diseases, strokes, and many other cardiac problems. Now, so hypercholesterolemia is the term which is medically used to refer to an high blood cholesterol level. Hypercholesterolemia comes in the umbrella term of hyperlipidemia, which includes various disorders that features high level of fat in your blood. So hyperlipidemia includes all the different disorders that features the higher levels of any fat in your blood, but hypercholesterolemia is particularly referred when there is high blood cholesterol in the blood. So now hypercholesterolemia is a type of hyperlipidemia that focuses only on the high LDL levels. It comes under the ICD-10 International Classification of Diseases 10 code E78.00. So the epidemiology of dyslipidemia, which is a very major cause of many diseases in our country also. So it is one of the most important atherosclerotic risk factor. And the reviews of many population-based studies in India have shown that there is an increasing mean total cholesterol levels in all the population of our India. So the recent studies have reported that high cholesterol is present in about 25 to 30% of the urban population and in about 15 to 20% of the rural subjects. Now this prevalence is lower than the high income countries. Many high income countries have the higher prevalence than India, but it is meanly increasing day by day. The most common dyslipidemia in India are the borderline high LDL cholesterol or the low HDL cholesterol and high triglycerides. So what we majorly notice in our population is the high triglycerides level, which will come under the high cholesterol report also. So now the type of different cholesterols. Cholesterol is used by all the cells in the body to keep them healthy, and it is carried around in body to the cell that needs it by protein in the blood. When cholesterol and proteins combine, they are called the lipoproteins, and they are the two type of lipoproteins. One is good for health and the other one is bad. So firstly, talking about the good one, high density lipoprotein or HDL, which is known as the good cholesterol. It gets rid of the bad cholesterol from the blood by taking the cholesterol which is not needed back to the liver, where it is broken down and removed from the body. So the good cholesterol takes the not needed cholesterol back to your liver. And the low density lipoproteins or the LDL is considered as the bad cholesterol, which contributes to the fatty buildups in the arteries. So these are two type of cholesterols, but one more fatty substance which we find in our lipid profiles is triglycerides. So triglycerides are the most common type of fat in the body, and they store excess energy from the diet. A high triglyceride level combined with an high LDL, that is the bad cholesterol, or low HDL, that means the low levels of your good cholesterol, is linked with the fatty buildups within the artery walls, which increases the risk of heart attacks and stroke. So triglycerides in combination with the different type of cholesterols can increase the risk of many cardiac problems. Now the different risk factors. So the risk factors contains both lifestyle and genetic ones. So they both play a role in causing the higher levels of cholesterol. But the lifestyle factors include smoking and tobacco use. So the smoking lowers good cholesterol or the HDL levels, and it raises the bad cholesterol or the LDL levels. Now being under a lot of stress, so stress always triggers the different hormonal changes. So it also triggers some hormones that causes the body to produce higher level of the bad cholesterol. Now, too much alcohol in the body can also raise total cholesterol levels. And having a sedentary lifestyle, not moving around enough with no physical activity, can also raise the cholesterol numbers. Food which are high in trans fats and high saturated fats, more processed and more packed products, may also raise the cholesterol levels. So these are some risk factors that can cause your cholesterol levels too high. Now, some symptoms. So, generally, the high cholesterol doesn't causes any particular symptom in most of the patients. They generally do not present with any symptoms, but it raises the risk of the further conditions like coronary artery disease or CAD, peripheral artery disease or PAD, high blood pressure, and stroke. So, these conditions are at risk with the higher cholesterol levels. So these are some dietary recommendations. What to eat in your high cholesterol levels. Don't avoid, try to avoid high trans fat, try to avoid the red meat, reduce the saturated fat in diet, reduce the intake of creams, cheese, palm oils, fried foods, butter, sami, say no to junk foods, and take a high fiber diet, take more fruits and vegetables, eat good fat like olive oils, so eat good cooking oil. So these are some dietary recommendations which you can suggest to your patients with high cholesterol levels. Now these are the normal cholesterol range, the total cholesterol range, LDL, HDL, and triglycerides. So these are the optimal, intermediate, and high ranges of the different cholesterols which comes under the lipid profile. Now the recent advances in the pharmacological management of hypercholesterolemia. So statins have been longly used in the treatment of dyslipidemias and hypercholesterolemia. And according to the latest guidelines also for the treatment of higher level of cholesterols, statins remains the first therapeutic options in the treatment of high cholesterol. But after the statins, many studies have been done on these both drugs, bempedoic acids and ezetimibe, which also suggests that bempedoic acid reduces the cardiovascular incidence and diabetes compared to the patients on statin therapies. So these are some new recent advances that have been done in the conventional system or in the pharmacological system in the management of higher cholesterol levels. Now, coming to our case. So, the basic information of my patient is he is 31 years male with a height of 5 feet 4 inches and a weight of 75 kgs. So, the BMI comes is 28.4. Address Noida, and he is working as a corporate employee. Hindu by religion, married. Now, the presenting complaints, the patient presents to me with the complaints of tiredness since 3 months. He says that he has no desire to get up for work, and especially in the morning, with a feeling of heaviness in the whole body. He says that I do not want to get up to work, and he have been feeling this sleepiness, this desire to sleep all day and all night since 2 months. And since 2 months he also told me that I have been noticing this weight gain, that I have suddenly started gaining weight too much from these 2 months. So he presented that he was apparently well 3 months back when he gradually started feeling tiredness and heaviness of the whole body. He says, बिल्कुल उठ के काम करने का मन ही नहीं होता, with desire to sleep whole day. And then he also noticed that he is gaining weight. Now, in the past history, he took vaccination of COVID vaccine, but only one dose. He had a surgical history of band ligation for the hemorrhoids 6 months ago. No accidental history, no hospitalization history, and no particular drug reactions were found in the past history. Another family history, the father is having hypertension, his paternal uncle is having DM type 2, auntie is having hypothyroidism, his mother is having hypertension and hemorrhoids both, and his maternal auntie is having DM2 and hypertension both. So this is the patient's family history. Now, under the personal history, all the developmental landmarks were on time. In the habits and addictions, he drinks occasionally and have a non-vegetarian diet, married, in profession, a corporate employee. No allergies were found. Surroundings at home are congenial. Nothing specific was found in the hobbies of the patient, and he is a graduate by education. Now, under the physical generals, appetite is normal with 3 meals per day. He takes 1 to 2 chapatis in every meal. But he said that he likes warm food. He says, then I like the food when it is very warm. I do not like it when it becomes a little bit cold. I ask that please make it warm again. So I like only warm food. Thirst is for 3 to 4 liters per day. Aversions, nothing specific in the aversions were found. And nothing specific in the intolerance was found. Tongue was clean and moist. Taste of mouth, nothing specific. Sleep, he sleeps 7 hours per day and it is refreshing. But nowadays he says that it feels like I want to sleep whole day. I cannot, but it feels like I have to sleep whole day. Urine is normal with pale yellow and non-offensive. Stools are also normal and satisfactory. Perspiration is on scale and his thermal reactions are hot. Now the mental generals of my patient. So he has anxiety about his own health. Actually, he was overburdened by the job in the previous months. So he was feeling a little bit pressure from the past few months. He's a very hardworking and diligent type of person who takes responsibility very seriously, who takes every work very seriously, and he wants to do everything in the righteous manner and in the right pattern. He wants to follow the correct path, correct way of working. and he works also very seriously. So he was also very anxious about his health, and he was also very anxious that why I am not able to work properly because of this sleep and because of this heaviness, this not able to work properly. And so he was anxious about these things also, and he takes the responsibility very seriously. He is managing the financial conditions of his own house. So he started working at a very early age so that the younger brother can take the higher education. So that's why he started early, and he is supporting his family also, and he's supporting the parents, brothers also. So he's a responsible type of person. That are all the mental generals of my patient. Now, the totality of symptoms I found is anxiety about the health of his own, industrious, conscientious about trifles, take responsibility seriously, desire for spicy food, appetite, desire for warm food, perspiration on scalp, tiredness with no desire to get up for work, especially in the morning, sleepiness with desire to sleep whole day and night. And this is the repertorial totality. So for the repertorization part, doctors, we will be moving to the software to see how to repertorize a case using RadarOpus software, and how I repertorized it with Radar and found my accurate remedy for this particular case. If you have any queries, meanwhile, you can type in the chat box. This is the RadarOpus software. You can see the interface of the software where we are visualizing all the repertories and the synthesis Adonis repertory. So today for the repertorization, I am using this synthesis Adonis repertory, which is the successor version of the synthesis treasure edition we used to use. So today I'll repertorize with this Adonis. And for the repertorization, I am opening these binoculars, which opens the navigation window. So these navigation window consist all the chapters of my synthesis Adonis repertory. Firstly, I'll be working with all my mental generals. So for that, I am opening the mind section. Clicking on this mind chapter, I have all my rubrics of mind. So firstly, I'll be taking my first rubric, anxiety. I'm just clicking on these letters to open my rubric. Anxiety, health, own health once. And this is my first rubric. Firstly, I'm using this take the current rubric icon to add my rubric in the clipboard. Now then going backwards again to my mind. In the second rubric I'm opening is industrious. Just dragging and dropping to add my rubric. Pressing the backspace key, I'm going backwards again. Now I'm again typing my next rubric, that is conscientious about trifles, and just adding it in the clipboard. Pressing the backspace, I'm going backwards again. Opening mind. Responsibility. Taking responsibility too seriously. And this is how I have added all my mental generals of my patient in the clipboard. So this is how fastly we can work with the software. Now taking the particulars of my patient, which consisted the desire for warm food. So I'm opening the generals, food and drinks, warm food, desire, and he had this desire of spicy food. So I'm opening this spices, desire, and I have added my rubric. So this is how I can find my rubrics through the navigation window and add them in the clipboard for further analysis. Or I can also directly find my rubrics through this search icon. I am taking the next rubric, perspiration on scalp. So these are all the rubrics about perspiration on scalp. Now the next symptom is weariness or tiredness, which comes with the rubric weariness. So directly with the help of a word, I can see all the rubrics about weariness, and I can select my rubric as per my choice. So I have these all the rubrics about weariness. So I'm taking this weariness, waking on. My next rubric is lassitude. So, taking this generals, lassitude. Just let me check. I have missed any rubric. Yes. Weariness, morning, waking on, lassitude, warm food desire, spices desire. So now by clicking on this clipboard icon, this repertorial sheet opens. So this is the repertorial chart, repertorial analysis of the case we just discussed, we just saw. All the rubrics are here. You can see all the symptoms of the patient, which we just took in the repertorial totality are here. Now, again, seeing the analysis, and this is the analysis of my patient. So the drug which is coming is lycopodium. Lycopodium is covering all the 9 rubrics, and it is gaining this 17 marks. So the most accurate remedy coming with this repertorial sheet is lycopodium. Now let's go back to our case. So this is the repertorization. Going back on the case. So I prescribed lycopodium 200, one dose start with Saclac 4 globules 3 times a day. And along with this homeopathic medication, the patient was also advised with the changes in the diet. And the patient was also advised with some mild regular exercise for about 20 to 30 minutes per day. So this was the general management which was also told to the patient alongside to the medicine which I prescribed. Coming to the first follow-up. In the first follow-up, tiredness was better. Sleepiness was also slightly reduced. So I just prescribed Saclac 4 globules 3 times a day, and the general management was advised to continue same. In the next follow-up, the patient's condition was standstill with no further improvement. He showed no further improvement in the condition. He said that again, I am feeling that much tired only, that much sleepy only. So I again prescribed lycopodium 200 one dose stat with Saclac 4 globules 3 times a day with the same general management which I told him in the first visit on the first prescription. Then in the third follow-up, the tiredness was improving, but the sleepiness was still steady. He still told me that I do not want to get up to work. work. I just still feel sleepy all day. Now the fatigue was going, but the sleepiness is still there. So I prescribed the next potency, Lycopodium 1M, one dose stat with Saclac 4 globules 3 times a day, and it was advised to continue with the same general management. In the fourth follow up, the patient showed improvement. He showed that everything is improving, everything is going fine now. All the complaints are also getting better. And the prescription was Saclac 4 globules 3 times a day with the same general management. So, this is how the patient's condition changed from not improving, from feeling all tired and sleepy to getting all better with this Lycopodium 1M single dose. Now let us see the results. So these were the results you can see in this lab investigations on 16th September when I first advised him to take this test of lipid profile. The total cholesterol level was 254, triglycerides were 337, and at first Feb when I again took this lipid profile, I advised and again. So the total cholesterol levels were 197 and the triglycerides were 143. The HDL cholesterol also, which was less in the first report, about 33, that came to the optimal condition of 44 in the second report. The non-HDL cholesterol, which was 220 in the first report, after the treatment it got better to 139. So it should be below 130, but it came till 139 in the next report. The LDL, which was 152, reduced to 100. It came 100.7, and the optimal is also just less than 100 only. So these are all the changes in the report. So this was the case of cholesterol and how I managed it with the help of RadarOpus software. I have completed my session. Thank you, doctors. Thank you for joining this session and have a good day.